Believe it or not, people who suffer from depression can actually be helped with a spice, and oftentimes it can be almost as effective as taking an antidepressant like Prozac. That's according to our next guest, Dr. Ajay Goel. He's the Director of Epigenetics and Cancer Prevention at Baylor University Medical Center. Dr. Goel, good to see you.
Good seeing you too, Steve.
So real excited about this spice, these botanicals. That's what a lot of your research is based on, right?
That is true, yes. So much of my research is on curcumin, which is the active principle in the spice turmeric. So turmeric is essentially the spice, and the active principle in turmeric is curcumin, which is we refer to as a medicine. So because it has medicinal properties.
Medicinal properties. So what is this connection here between this curcumin and depression? What have you found?
So what we have found, this is the first human clinical trial where we have looked for the effect of curcumin in people who have chronic long-term major depression. So this is the first clinical trial where we took patients who are chronically depressed. We gave them either the standard of care drug like Prozac,
right,
and in the other arm we gave patients just curcumin. So we gave them curcumin 500 milligram twice a day, which is very small quantity, and we gave them only for 6 weeks. And we were very surprised to see ability to reduce depression in both arms was equivalent. So
So what you're telling me is that by taking the curcumin 500 twice a day,
yes,
was as effective as Prozac in improving the symptoms.
That is true. So that was surprising to us too, because we knew that curcumin has been shown it is a very strong anti-inflammatory. So we expected it to work, but we never expected it to work as good as Prozac. So which is very exciting, because we know that some of these drugs, when you take Prozac and others, when you take them for a long time, they are associated with some sort of side effects and all that. But when you take curcumin, which is a natural botanical, it's a spice, it is not toxic, and people take these things for their life.
Right.
So,
now, we don't want to tell people that have depression to stop taking their meds. Don't
absolutely
do that. You want to talk to your doctor if you're on these medications. But is there a danger if you took curcumin with an antidepressant, or we just don't know that just yet?
We don't know yet.
Okay.
But in general, there's all the published data, at least so far, to the best of my knowledge, curcumin has not been shown negative interaction or any adverse reaction with any of the medications.
With any of the medications. Okay, that's good to know.
Yes.
All right, so you said you can take a supplement,
that's
500 milligrams twice a day. But what if you took it in your diet? Can you eat enough curcumin in your diet to have an impact, and do you have to take it every day? Does it mean I have to eat something with curcumin in it every single day?
Yes.
Yes.
So the answer is yes. If you can eat turmeric 3 meals a day, then probably, and you have to eat it for a long time. So
right.
So I come originally from India. People in that part of the country, they consume 3 meals a day, and every meal has turmeric in it.
It's that common? Well,
it's that common. So in that case, it is fine. But if living here, you cannot expect people to be eating 3 meals a day. So I think the best way to utilize this would be to consume it as a health supplement. Take capsules. You can find them in any health food store, and you use them as a supplement.
Well, that's really exciting, actually. There's also some research with curcumin and arthritis. Tell me about that really quickly.
That's true. So we published a similar clinical trial, first human clinical trial, where we gave patients, those who had chronic rheumatoid arthritis, so we gave them curcumin, and also in the other arm we gave them the standard of care non-steroidal anti-inflammatory drugs like ibuprofen. So actually in that study what we saw that curcumin, and this was only an 8-week study again, and what we saw actually curcumin was slightly better than their NSAID.
Wow, so it's this powerful anti-inflammatory, and also may work for cancer?
Yes.
Cancer prevention?
That's my major area of research, and we have demonstrated it over and over that it helps in prevention of colon cancer, breast cancer, prostate cancer, and I think all of it is possible because curcumin is a very strong anti-inflammatory compound, and inflammation is the root cause of most chronic diseases, whether we're talking about depression, arthritis, cancer, and if it can reduce inflammation, it can help with all of these things.
I just love when we find natural ways to fight disease, and it's right there. It's available to us. Dr. Goel, thanks so much for coming in. Really appreciate it. Some really great information.
Thank you.